This segment of Delmarva Life is sponsored by TidalHealth.
You may remember that February is American Heart Month, but if we're honest, heart health is something that should really be a year-long priority.
Yeah, there are certain genetic risk factors that play a role in our heart health, but there are also plenty of measures we can take to keep ourselves strong. Joining us with more valuable info is Dr. Rick Simons with TidalHealth Cardiology. So good to see you back.
Sure,
Welcome.
good to be here.
Yeah,
Thank you.
yeah.
Thank
so
you.
let's start off a little bit about just heart health in general. It's not something that we should concentrate just in February. What can we do year-round?
Well, it's multidimensional. Okay, our health has multiple input points that we can improve on. Heart health really is in coordination with your total body health. Mm-hmm. The things that we do to improve heart health will improve our total health. When you look at societies around the world, they're called the blue zones, Sardinia, Okinawa, Nicoyan Peninsula in Costa Rica, Icaria Island off of Greece. All these cultures emphasize healthy diet, plant-based, basically Mediterranean-style diet. They're all physically active. A lot of them are shepherds, or they go out and they plant gardens and they walk. They're very socially active. Mm-hmm. They have purpose in life. The Okinawans call it a kije, the reason they get up in the morning. So all these aspects contribute to our health. When I was on previously, I mentioned some dietary things. Right. Soluble fiber helps reduce the absorption of cholesterol. Insoluble fiber helps the gut microbes form short-chain fatty acids, which are anti-inflammatory, help control diabetes, help prevent vascular inflammation.
All kinds of good things.
Even maybe help prevent Alzheimer's.
Okay,
Nice.
While you're there, I need to ask you a question. When I get my blood work done and I get it back, it says lipids. What the heck are lipids?
Lipids are fats in the blood.
Okay.
And there's several classes. One is your total cholesterol, one is your triglycerides, one is your we call good cholesterol, HDL, which takes some of the cholesterol and fats out of the blood and puts them into the tissues. Okay. So it's kind of a clearing mechanism. And then there's the bad guy, LDL, low density lipoprotein. That is the stuff primarily that gets into the blood vessel walls and is part of the process of building plaque. Okay. So we don't like LDL.
No LDLs.
That's the bad guy.
Mm-hmm. And of course, a lot of people are on medications to control that, other heart medications. It's important to stay on those medications, isn't it?
We have wonderful tools now to lower cholesterol that we didn't have before. When I started practice, statins weren't even invented yet. Well, they were invented, they hadn't come to market yet. But lifestyle is foundational. What we eat is foundational to our health. So a good, healthy diet, whole foods, lots of fiber, lots of antioxidants, lots of bioflavonoids, what you get in whole healthy foods, fruits and vegetables and whole grains, that's foundational. We have statin medications that lower cholesterol. We have newer ones. There's one called bempedoic acid that can lower cholesterol. That's a non-statin. We have injectables now. We have several different types of injectables that fight a protein called PCSK9 that damages your LDL. I don't want to get too technical, but these shots that work, and they help lower your cholesterol. So we have tools now that we can aggressively lower your cholesterol.
So let me ask you this. I'm at home. I feel like I'm starting to have a heart attack. Can't I just get in the car and get to the hospital? Aren't I going to get there quicker than if I call 911?
Good question. Depends on how far you live and depends on how active your EMS is. Right. The bottom line is, if you're really struggling, if you're feeling weak or short of breath, sweating, you probably should activate EMS.
Good, sir. Get the EMS.
Okay, so there are a lot of people maybe have had a life with not so great lifestyle choices. Is it never too late?
It's never too late. There is a movement in medicine now called Food is Medicine, where they do medical therapeutic diets, and they put diabetics or people with hypertension on a medically diagnosed or medically designed diet, and they can improve the hemoglobin A1C, the glucose metabolism. They can improve blood pressure. So changing your lifestyle, even when you have disease, is favorable. But the real power of lifestyle is upstream, preventative. And unfortunately, in our society, we have drifted away. Those blue zones, we're not the blue zone here. So we need to be more blue zone-like. And we can take the fundamentals of those cultures and try to apply it to our culture. Try to eat healthier, try to move more, try to socially engage. So those are upstream things we can do to increase what's called our health span, the years we have of healthy living. Because a lot of times in conversations with my patients, a lot of people say, well, I don't want to live too long or too old. What they mean is they don't want to be sick too long. But we all want to be healthy as long as we can. So we need to adopt a lifestyle that improves our health span, so we can live healthy late in years. And that's what the blue zone people do. They live healthy into their 80s, 90s. Even there's a lot of centenarians in the blue zone.
And they look good.
Yeah.
They do, and they feel good, and they're active, and they're enjoying life.
And there you go. That's what we want.
Dr. Rick Simons, TidalHealth, thank you so much for
Oh, you're
coming
welcome.
in.